I never thought that I would become blind. My vision was fine, no pains and no symptoms. But that's exactly how glaucoma works. It steals your vision without any signs. It's known as a silent killer. If I could go back in time, I would change things so much differently. But I can't do that. But what I can do today is tell you what to do and not to do so that you don't become like me and lose your vision. When I was younger, around the age of 14 years old, that's when I started to develop glaucoma. I didn't even know the signs of glaucoma and what glaucoma is. I was your ordinary kid just going to high schools. I had cataract at the time due to kidney failure and kidney transplant, but I still had no knowledge of glaucoma or any signs of any pain. And with glaucoma, you start to lose peripheral vision. As well, you'll start to get eye aches. I started to develop eye aches, but I thought that wasn't part of glaucoma. I thought that was something normal. I could take Tylenol to relieve eye pain. I could do eye rubs to relieve the eye pain and just do normal eye drops. However, I was still taking eye drop medications for glaucoma, but I didn't know how severe glaucoma could be until I lost my vision. The signs that I didn't really take into considerations was the eye pain and my peripheral vision slowly getting less and less. Because with glaucoma, it doesn't really come in it really doesn't come in a way there you're just knowing it's there. It comes so slowly that you don't even know. But if I could really change all of that, I wish I would. So when I started to develop glaucoma, that's when it really hit me that I'm losing my vision and I'm starting to become blind at such a young age, around 14 years old. I wish I knew about eye pressures. I wish I knew about glaucoma. I wish I knew how important eye exams was, but I didn't at such a young age. I wish I knew everything about eye health and how important it is, because your eye is such a significant thing and part of your body, because you are able to see the world, able to communicate with people just through your vision. You don't even have to say a word. You can talk to somebody just through your sight. Sometimes that's even a love language. All you gotta do is look at somebody, look at your significant other through your vision, and sometimes you can tell if somebody's mad with just the look on your eyes. But once you lose your vision, it's pretty much like a life or death situation, because you don't feel like living anymore. It becomes a more mental toll on you and a more of an emotional toll. So I wish I knew all of these things at a young age, but I didn't, because when I was a kid, you just think of living life to the fullest and being able to not really stress too much. I still got bullied just because of the kidney related issues, but I didn't know anything else about glaucoma. If I knew all of these things about eye exams, eye pressure, glaucoma, I would have taken my eyes more seriously. And if I had to give more tips on about eye health, what I suggest you do is make sure you prioritize your eye exams. Prioritize eye exams at least once a year or every 6 months, depending on your eye, because sometimes you can have eye damage. Your eyes are very damaged and you may need to get your eyes checked very often. And if not, every year is fine, or every 2 years. But it's very important to get your eyes checked. Please and please, optometrist just to get your eyes checked, or specialized in a field of ophthalmology. It can be in the glaucoma world or cataract world, but as long as you're getting your eyes checked. And I also do recommend to get some type of genetic history, family history, to see if any of your family has anything related to eye health or eye problems, because nobody in my family has glaucoma, but I'm the first person in my family to have glaucoma, steroid-induced glaucoma to be a matter of fact, but nobody else has glaucoma, and I'm the first person to have kidney disease. I'm the first person to have pretty much almost all the diseases. If you think about it, I drew the lucky card of them all, of my whole family related to me. I got all the diseases, and I'm just trying to live my best, but I'm also trying to teach you guys how to not get your vision lost or any other diagnosis develop. So it's important to do some family history and genetic testing. And another thing is to learn about eye pressure. If your eye pressure is normal, around 15, around 12, if it starts to get bumping up around 20 or anything higher, it starts to become a little concerning, but not too concerning. That's where you want to still get monitored almost every 6 months, because they don't want to make sure that it's not going too high, because once it gets too high, that's when you'll notice you'll start to develop glaucoma, or it could just be normal tension glaucoma where you don't feel pain and that your pressure is just getting higher. So it's important to get those three things done. And another thing is to also, I would say, is to limit your screen time. Very important to limit screen time. You don't want to use screen time too much, such as your phone, your laptop. I know that we live in a world of technology, and with technology we tend to use our phones a lot, with social media and with our computers, but it's also important to limit screen time. About 30 minutes break when you're using it. Use 30 minutes time, 30 minutes break, 30 minutes, 30 minutes. So just make sure to limit your screen time. And it's also important to make sure you get your rest and relieve your eyes, because resting is important. Getting good night's sleep, elevating your head is important. So these are my 5 tips that I recommend for you, so that you don't lose your vision like me, because you wouldn't want to lose 70% of vision in your right eye and about 30% of vision in your left eye, and you don't want to become blind at all. These are just my tips, and I hope this video helps you and gives you the advice you need so that you don't become blind just like me. And if you do enjoy, please subscribe and give this video a thumbs up. Thank you.